Hi, I'm Jeff Holden. Welcome to the Nonprofit Podcast Network. Our purpose and passion is to highlight a nonprofit organization in each weekly episode, giving that organization an opportunity to tell their story in their words to better inform and educate the respective communities they serve, as well as provide one more tool for them to share their message to constituents and donors. Our goal is to help build stronger communities through shared voices and to both encourage and support the growth of local nonprofit organizations through podcasting. Thanks to our partners for their support in getting these stories told. CapTrust, fiduciary advice for endowments and foundations, and Western Health Advantage, a full-service healthcare plan for individuals, employer groups, and families. I'm proud to welcome our newest partner to the program, CORE, Interim and Fractional Executive Leadership, Comprehensive Back Office Support Services. We work in it so you can work on it. Visit cxore.com. Just starting this episode, I can't help but think of my favorite menu item. Fries, in case you were wondering. I'm opening the door to a place many people have heard of, but few truly understand. Ronald McDonald House Charities of Northern California. I'm joined by Stacey Hodge, who first volunteered back in 1997, and former board member Jerry Alestra, whose family experienced the house during his granddaughter Eliana's first fragile months. Together, we unpack what a home away from home really means. 39 private rooms a night, day use support when beds are full, warm meals from volunteers, even a teen hangout, and a cart with a heart that brings comfort right to the pediatric floors. We'll talk about Camp Ronald McDonald at Eagle Lake, how referrals work across hospital partners, why a penny per happy meal and the Roundup at the register really matter, and clear up the big myth that McDonald's covers everything. They don't. With only 13 staff, a lean budget, and an army of volunteers, this charity turns small acts into life-changing proximity for families in crisis. Stay with us for the human story and the simple ways you can help. Stacey Hodge, Jerry Alestra, welcome to the Nonprofit Podcast Network.
Thank you for having us. I appreciate it.
Good day, Jeff.
Thank you. So what's kind of exciting about this is most people know what we're talking about generally. I mean, who doesn't know McDonald's?
Right.
But I don't think many people really know or understand what the Ronald McDonald House is, other than the superficial misunderstanding of it. It's a house for Ronald McDonald.
Right.
Which is anything but.
Right.
So let's start from a really neat spot. Stacey, you've been working with the organization in some way, shape, or form, starting as a volunteer in 1997.
Yes, the late 1900s, yes.
Yeah.
Actually, that sounds so long ago when you position it that way, but it's so true.
Yeah.
What was that orientation like? And I think that'd be a great way to get us oriented to the genesis of the Ronald McDonald House here in Sacramento.
So I saw an ad in the Sacramento Bee. There was a Helping Others column, and they were looking for volunteers. The first Ronald McDonald House was opening in Sacramento, and we're still the only Ronald McDonald House in Sacramento. And they were looking for volunteers. I was staying home with my kids at the time, but I had a background in marketing, PR, special events, and so I came to the house to find out what it was about and learned along the way that it's temporary housing for children and families that come to Sacramento. They need a place to stay while receiving medical care. They can be being treated at any hospital, any medical facility, and they can stay at the Ronald McDonald House. And that keeps the families close and the parents nearby. And sometimes the child is on an inpatient basis and they're actually at the hospital and the family's going back and forth. And sometimes the child stays at the Sacramento Ronald McDonald House and then the family is taking them to appointments. I also learned that in addition to the Sacramento Ronald McDonald House, the other main program is Camp Ronald McDonald at Eagle Lake, which is a camp for campers with disabilities and disadvantages. We're on 35 acres near Susanville, California. And so there was multiple programs that I wasn't aware of with the charity. And as far as McDonald's went, I assumed that McDonald's provided all of the funding for the charity, but they are a partner in the charity. And they started the first Ronald McDonald House in Philadelphia in 1974. But they don't provide 100% of the funding. They do promotional items and things within the stores, like the Roundup program, that does benefit the local charity, but their business is hamburgers. And so they are supportive, and we are their number one charity of choice, but they don't provide all of the funding.
And let's not forget fries and shakes, too.
Yes, yes. And so we do get
my favorites.
Yes. We do get a penny for every Happy Meal that's sold.
Oh, wow.
And then what's been really popular lately is the Roundup program, and that benefits our local chapter and just really makes a difference. And I don't know that people realize a couple cents here and there really adds up and really makes an impact for the family and children we serve.
Yeah, when a little do a lot, it adds up.
Yep.
Jerry, you were going to offer something, and as a former board member, you have a very good understanding of the organization as well.
Yes, sir. I do want to add just a simple little thing because it's the two sides of the same coin on this, and it's really come to fruition how. I'm gonna get emotional, I think.
It's okay.
Okay, let me slow down. My granddaughter stayed there, so when I simply want to say to everybody out there, it's a home away from home, and the people make the charity. It's just a building. And people like Stacey are workers there that work for the charity, the people that volunteers, the different companies that come together from outside, and they make Ronald McDonald House Charities in Northern California what it is today. And they make a difference in people's lives.
Mm-hmm.
Thank you.
And we are going to get to your story a little bit later, which I want you to hold that thought because we're going to.
I'm a little passionate.
We are going to get to your full story.
Gotcha.
How many families can you serve at any one point in time?
We can serve 39 families a night at the Ronald McDonald House. At Camp Ronald McDonald, we're serving about 1,200 participants, campers, and assistants for one summer. And at camp, we're only open during the summer, kind of from Memorial Day to Labor Day, and then otherwise we're snowed in. So between the house, 39 families, somewhere around 1,000 to 1,200 families a year, and then about 1,200 families or campers at our camp.
And there's never a cost to the families, correct?
Correct. So we ask all families that stay at the Ronald McDonald House if they're able to make a $20 donation per night or even a portion thereof, but most of them cannot, and that is completely fine. So a lot of times they lack the resources to make that donation, and so that's what we do in terms of fundraising. The actual cost to the charity is about $95 per night per family. So you can see there's a little bit of a deficit there. Mm-hmm. And that's what my department does is we are community relations. We do the fundraising and outreach into the community.
Stacey, with regard to you work with multiple hospitals.
Yes.
All our hospitals. You're on the UC Davis campus.
Yeah.
But how do you actually work with them? How do you know? How does a family become involved? How do they get to Ronald McDonald House with all the different hospital campuses that we have in the area?
Right. I always say to people, if you've never heard of a Ronald McDonald House or don't know what we do, that's a good thing. That means you've never had to stay at one. You don't know anyone that's ever had to stay at one.
That's right.
Right? And but when they get their referrals through medical personnel, so through the hospital usually. Nurses or social workers will let them know that we have availability, and they go through the process of seeing if we have availability. Unfortunately, we're full a lot of the time.
I would imagine.
39 families a night. And so if we are, then we're able to put families on a waiting list. And usually they're on there about 2 nights or so, and then we can get them in. But we also have a day use program. So if we don't have availability to spend the night there, we are able to open the facility so families could use our laundry rooms, our brand new nap room, our barbecues, our playground area. They can take showers. They can hang out and watch movies. So it's a way that they get a little respite from the hospital. So it's open to pediatric families at any Sacramento area hospital.
And I would imagine the spectrum of care that's going on for the children can be very, very broad. You may have people who are only there for a couple nights, but I know when we visited the facility, you had people, at least one family had been there for quite some time. How do you manage that, or better yet, what is the average length of stay?
Average length of stay is somewhere around 15 to 16 nights. But I looked at our census this morning, and we have one family that's been there 305 nights.
Oh my gosh, almost a year.
Yeah. So you do get those extremes. And then you also get the families that think they're going to check in for 2 weeks and they get to go home early.
Okay.
So that's a part of what we do, is because when families are near a child, they heal faster, they get to go home quicker.
Yeah, and that makes perfectly good sense. Not to mention just the emotional toll it takes on everybody. A, when a child is sick or challenged, needs surgery, whatever it may be, but B, all the way through the extended family.
Exactly.
And do you typically just house the immediate family, parents of the child, or is there more with grandparents or visits? How does that all work?
So anyone that's a support person for that family is welcome to stay with us as long as we have the room. And so a lot of times, siblings, grandparents, aunts, uncles, neighbors even, we see more siblings during the summertime when the kids are out of school. And a lot of times when they're in school, you'll have one parent at home with those kids because they're still going to school, and one parent staying at the Ronald McDonald House because they have a child that needs medical attention. So it just kind of varies. But anyone that's a support person for that family is welcome to stay with us.
And what will they find on campus? What's there?
There's a lot. So, like Jerry said,
and I kind of teed that up because I got to see it, so I know there's a lot.
So we are a home away from home. And so we want to provide all the amenities that these families would have at home. So they all have private bedrooms. They all have private bathrooms. We also supply laundry rooms. We have a workout room. We provide a continental breakfast 7 days a week. We have a barbecue area. We have a covered patio area, a playground. We have a game room where kids could go in and game for the day if they want. We have Hard Rock Hotel and Casino is one of our sponsors, and they sponsored the Hard Rock Hangout Room for kind of our tweens and older kids to kind of hang out. And they have video screen. And so again, it's comfortable, it's safe. Anything that these families might need that they can ask us for, we will find a way to make it work for them. We don't provide all their meals, but again, we do a continental breakfast. We provide pizzas on Tuesdays and Thursdays, and then we have volunteer groups that come and do our Meals from the Heart program where they make a lunch or dinner for our families. So anything that they might need, we're trying to provide for them.
And they have kitchens too, so they can
absolutely
prepare their own should they need to, choose to. And I know some of the families probably have particular needs for types of food, ethnicities, different types of foods that want to prepare their own stuff. So it's quite an amazing facility. Not to mention there's a Ronald McDonald there.
Yes, there is.
The kids can kind of hang out, and we'll have a picture somewhere in this the discussion of us sitting by Ronald, my producer, and I, because it was fun.
It was fun.
Collaboration. Clearly, you're a part of our community, and having been around for so long with the facility now really well known, what does collaboration look like to you? Who do you work with?
So a good example of collaboration, I would say, looking at Camp Ronald McDonald, we work with a lot of user group, nonprofit organizations that bring their camps to Camp Ronald McDonald. So an example is Camp Recreation, and they bring developmental youth with developmental disabilities to Camp Ronald McDonald, and so all the programs are geared towards the disabilities of that group. We also have Camp Kesem, and which is for our youth that are dealing with parents that might have cancer. And we also have another group that are deaf and hard of hearing. And so we collaborate with those camps and gear all of our programs for the disability of the week that they're there.
Boy, I'm thinking we work with an organization. We had an episode for Me One out in Placer County.
Yeah.
I'm sure in some way, shape, or form they're connected. Certainly Chat Center with children with hearing disabilities.
Mm-hmm.
Yeah, that's just so neat, the way that you interface with these other organizations. What about our law enforcement and just civic organizations? How do they interface? Because I know they're involved in some way, shape, or form.
Oh, absolutely. Especially, a good example is UC Davis Police. We sit on the campus of the UC Davis Med Center, and the UC Davis Police have been amazing. They have brought out their canine dogs. They have come over and done hot dog barbecues. They've done toy drives, wish list drives, and so we work really closely with them. And then also our local fire department has brought out fire trucks for the kids that we serve and the families, so they get to see those kinds of things. And it's just exciting for our families to be able to interface with these groups, and I just think it makes a big difference, a special treat.
Oh, and it's so far above and beyond just the illness that you're immediately dealing with, to where maybe siblings now have an experience that what could potentially be a horrific experience. They're in the hospital and brother or sister is really ill or needs some particular care. Now it becomes, my gosh, that brother, sister is being cared for, yet they're getting an experience they would never, ever get in any other situation.
Absolutely.
So it becomes a really positive, encouraging, and referral-based, enthusiasm for not only the organization, but even back to the whole McDonald's franchise group. The facility itself was a capital campaign.
Yes.
And you talked a little bit about the way it's funded. Let's talk a little bit more, because I think people, they tend to think, well, there it is. It's all taken care of and we just go. But in fact, that's not really the case. The capital campaign builds it. It's paid for. You don't have to worry about that.
Right.
But it has to be maintained.
Right.
And it has to be, providing the services. Talk to us a little bit about that.
So we want to be diverse in terms of fundraising, so that our funding comes from a lot of different sources. So an example is we have a sponsorship program called Adopt a Room. And this is where folks, organizations, individuals can sponsor bedrooms and buildings at the Ronald McDonald House. It starts at $2,500. It's an annual sponsorship. And then their name is on our website. It is on that room. And then they get quarterly updates of how many families stayed in that room, where the families came from, how much that sponsorship impacted the families that we serve. And that's one of the ways that we provide funding.
I really like that, because you see the immediate impact of your contribution over the course of that year for those families.
Exactly.
Yeah, that's pretty neat.
Exactly. And then we do 2 special events a year. We do a sporting clays tournament in the spring, and then we have our 2nd annual pickleball classic
coming up. I saw that on the website.
October 25th. I'm not a pickleball player, but I'm learning.
Way to jump on a trend.
It's at Johnson Ranch in Roseville, and it was our last year was a lot of fun. We did a pickleball drop where folks could purchase pickleballs, and they're dropped from a lift, and then the pickleballs that are numbered that land closest to the bullseye win prizes, including cash. So you can win $1,000 and you can win $200, and we have Southwest tickets that are part of that raffle. So it's exciting and fun for our pickleball players, but you don't have to be present to win, and so you don't have to play pickleball. So they're available online. Not online. We don't sell them online, but all the information is online on our website.
And we'll get to that in a little bit, too.
And then we write grants, and we have a vehicle donation program. So we have lots of different things that we're doing to provide our funding.
So basically, you're privately funded here in the community. It's all your effort. There's no federal funds coming in. It's either grant-oriented and or from philanthropic donors.
Exactly.
Which is great, and, given the situation that we see, at least for the foreseeable future, that the house is going to be in pretty good shape.
Yeah, that's our hope.
Yes.
That's our hope.
As a former board member, Jerry, I too have been on many boards. This is always our greatest challenge. It's the development side of things. What's your perspective on it?
Well, there was a lot to learn on the board, because I've never been on a board. Prior to that, I was kind of tricked by Mike Gannon, if he's listening to this, coach. He said, yeah, come on over. It's great. It's easy. And the next thing you know, I'm on the board. But it's been a life-changing experience, because you see how much you have to coordinate with other companies to raise funds, to do the events, to reach out, create programs. One of the biggest things I saw on the board was, how do we allocate that? We're always looking the future. How do we provide for the people that really need a place to stay, especially during a serious illness? How do we forecast building a new building? That was part of the thing we got to deal with when I was on the board. How do we enhance the barbecue area? Add different things to keep it refreshed. So it was tremendous work, and that's where Stacey's group and team comes in. Of course, the volunteers and subcommittees. There's subcommittees, and it's just, at first you look at it and you're like, okay, it's a board. However, there's so much more to it. And it really provides a deep gratitude personally as you are pouring into your community, giving back. We do commit to give back regardless. Especially, I always commit back to the Clays tournament. That's one of my favorites because that's what we kind of help out from Southwest Airlines. But it is a family too. And what's really neat about it, we have collaboration and we may disagree on some things, but the more people you have in there thinking, how can we protect the families here? How can we protect our community? How can we give back? It's really remarkable.
Mm-hmm. Great explanation. Thank you. Appreciate that. It's time to take a break. Big Mac, fries, and a large Coke, please, to hear what the people who make this program possible have to share.
We are really excited to be part of the family and contribute to the work that you all are doing. CORE provides fractional and interim executive services, along with comprehensive back office solutions that go into our client sites and do the work to give them the capacity they need in order to move through transitions, whether that's planned or unplanned. Or companies also work with our accounting and finance, back office solutions, human resources, technology, and administration. The reason why our back office solutions add value is because we save them time and money, anywhere from 20 to 30% of what they would spend on that back office solution. We work in it so they can actually work on it. CXORE.com, and contact me directly at DTEAT@CXORE.com.
If you're interested in learning more about how CORE may help your organization, visit CXORE.com.
Hello, this is Scott Thomas with Cap Trust in our Sacramento office. I specialize in working with local nonprofits and associations. Annually, we survey private and public nonprofit organizations across the country to better understand challenges they see in today's environment. In our more recent survey, we heard concerns about proper board governance, mission-aligned investment, and how to implement alternative investments. If you would like a copy of the survey or to discuss your organization, look me up, Scott Thomas at captrust.com.
I'm thrilled to have Western Health Advantage partnering with us as they do so much to support so many nonprofit agencies in our community. As a truly local health plan, you'll find individual and family options, employer options, plans for CalPERS and Medicare Advantage. From medical services to pharmacy, health and wellness support, as well as behavioral health care, Western Health Advantage has a plan that fits what you need. As an employer, for profit or nonprofit business, individual or family, you can find more at westernhealth.com. One of my favorite questions that I get to ask of anybody sitting in that chair, Stacey, is dream big.
Okay.
If money's no object, what would it look like? What would the organization look like?
So what it would look like is never having to turn a family away. And again, it's generally on a waiting list for just a couple nights, but always having availability all the time. So there's always a place for a family to stay. Right now we're impacted. Like I said, we're full most nights. So that's a challenge. And on the property we sit on, we could potentially add more rooms. We did do an expansion about 10 years ago. So it's something we always keep in our back pocket is when is it going to be time to expand? And that would be the launch of a new capital campaign. And but something definitely on the horizon.
Wouldn't need a capital campaign if you had that blank check. Somebody's just sitting here saying, let's go.
Exactly.
Let's get it started.
Well, tell us the name.
Right? Ask. This is out in the ether, so it's like
Right on.
whoever that might be. What number do you think would be an appropriate number? Because you've been there long enough to see the ebb and flow of dynamic. You've had a second construction phase. Now you're full basically all the time. we're growing, the community's growing. What does that number look like? What do you think? If you've got 39 today, is it 50? Another 10 helps? 12?
Yeah, I would think at least 10, 15 more bedrooms at least. There are options to put family rooms inside hospitals, and that could alleviate a little bit of that, the pressure for the available rooms. Having the day use program also makes a difference for
Hmm.
families, and because some of the families are bedside and want to be bedside,
Sure.
and although when they do come to the Ronald McDonald House, they do get that respite from the hospital, even if it's just to grab a quick meal, take a nap, take a shower, and they're back to the hospital.
Hmm.
And that's pretty common, actually. But the other thing that happens is you bond with other families that are there. So you meet other families, you're sharing a lot of facilities, and so you get to know them. And we see a lot of friendships develop as a result of families being there. And so a lot of times when they return, they tell us they're still staying in touch with families that they met last time they were staying with us. So that's like a little added value to it.
Yeah, that's great to hear. And it's those shared experiences in trauma, especially, where the bonds tend to be deeper.
Yeah.
And as those children grow up together, depending on the ages, if they were close, all of a sudden now you've got a true familial relationship between different parties
Yes.
and kids that maybe have, kindred spirits in some way, shape, or form, not to mention siblings and what all that looks like. I saw a lot of other children running around when we were there
Yeah.
and wondering, well, what's all that? Where are they all? Well, they're the siblings of.
Yes.
And
Yes.
they were having a ball. So
Yes.
it's obviously what kids need. They don't need to be bearing the burden of a sick sibling or a sibling that's got a disease or an accident or whatever the case may be. As you look at the next steps coming out of the dream state into the reality of it all, what is the greatest need that you've got?
I would say probably it would fall under dollars for sure, because all the dollars that go into our program go directly to the children and families that we serve, both at the house and the camp. Our overhead is just 3%. So 97 cents for every single dollar that we raise goes back into our programs.
Mhm.
We are very frugal and make sure that we want to steward our donor dollars appropriately. I would say for people that want to help, that we always have ongoing wish lists on our website, in addition to a way that they can donate dollars. But we have a ton of wish list needs because we go through just so many snacks and things that families request, from microwave popcorn to canned goods to batteries. And we also have a cart with a heart, which is our hospitality cart that's in the hospital. And what we do there is we're on the pediatric floors and we go room to room offering drinks and snacks and activities for families that can't get out of the hospital room. And so we're always going through a ton of individually wrapped snacks and drinks and little bottled waters and small juices and things like that. So all that we update on our website on a regular basis. And I would say those are probably our two biggest needs.
I love Cart with a Heart.
I do too.
Yeah.
Got to know him really well.
Oh, yeah.
And we'll get there. And Jerry, from your perspective, again, board member perspective, budget, funding, we're always dealing with that. It's always part of the equation. How did that look like from a board perspective as you go through it?
That was a great question. I think what helped me is I was part of the Chamber of Commerce's in the Sacramento region, whether it was the Hispanic or whether it was the SAC Chamber.
Metro, yeah.
Yeah, Metro. And you get those connections. And of course, when you're on the board, all you want to talk about is what the house is doing and Camp Ronald McDonald, because sometimes they hear about Ronald McDonald House, but I would really push people and tell them to come out and check it out. I would also say, if you got any information, contact Stacey. She'll be able to give you all the details. However, from that aspect, I think that gave me more access to people to really tell the story, to really give them the what we're doing, what we're trying to do in this community. And that's how you draw those people in. So it was really neat. Now, Southwest Airlines, they actually support the Ronald McDonald House Charities from a national standpoint. And so that was an opportunity to connect with people in different cities that may be moving here too. I get transfers. I got in-flight people that live in Sacramento, but they're based in a different city. I would get emails. Do you have a Ronald McDonald House? So it's the connections, and then the word of mouth gets out.
Mm-hmm. Yeah, it's great that you have that national perspective platform because there are so many Ronald McDonald.
Yeah.
How many are there in the country? Do you know?
I don't know.
Oh, man. We'll have to look that up.
And we're international. And
Yeah.
so I think
wow.
there's, over 300 chapters worldwide. But generally, I tell people if there's a children's hospital in any town or city, there's normally a Ronald McDonald House nearby.
And in terms of the actual employees for the house, including the camp and everything, how many employees are there?
We have 13 full-time employees.
That's it.
Yeah, that's it.
How
Year-round.
does the rest of the work get done? Is it all volunteer?
Great question. We do have a ton of volunteers, and I'll tell you, they are the heartbeat of this charity. And they do everything from, we have ongoing daily volunteers that help with checking families in, getting things that families need. We have Cookie Brigade, which are our volunteers that come in 5 days a week and bake cookies for our families. So they always have fresh baked cookies.
Where were those when we were taking our tour?
Yeah.
I didn't see any fresh baked cookies anywhere.
We got to keep our cookie jars full, but we
That's
do go
right.
through a lot of cookies. And so our volunteers also help with events. They help with our yard work. We have monthly work parties where folks come in the first Saturday of every month and they help with our gardening and getting our cobwebs out from underneath the eaves and all those kinds of things that need to be done and really help us keep our overhead low.
What's the budget you work with? What's a rough annual budget?
We're about $2.5 million.
Okay, that's a significant operation.
Yeah,
So there's a lot going on there.
there's a lot going on.
Yep.
Yeah.
We're going to talk about something that's going to be very personal. Jerry, you're here for multiple reasons, right? You have experienced the Ronald McDonald House personally. Would you share with us what your experience was?
Absolutely. What's interesting is my kids volunteered at camp, and they were very interactive at the house. When we had the barbecues, they would play with the kids there. And so my youngest son, Jerry Alestra, and his wife, Taylor, they were pregnant, and it was a real joyous time up to the birth. And Eliana,
Your granddaughter.
my granddaughter, yeah, she had some complications with her heart and lungs. And so there were many surgeries and procedures. There was many times we prepared for the worst as a family.
Mm-hmm.
And so this experience, that's why I said that in the one comment, there's two sides of this coin. And you never really know until you experience both. So it was a traumatic time, a lot of unknowns. I think I forgot your question, Jeff, because
keep going, because so you've got your granddaughter born with multiple complications,
Yes.
heart. How did you interact then with the home, with the Ronald McDonald House?
Well, that is a great question, a fantastic question, absolutely. When you're in the motion of this and you're dealing with the different scenarios, you're trying to support your son and your daughter-in-law. She's my daughter. But when you're there in the experience of the hospital, and first of all, Sutter PICU is beyond awesome. You get to know the people very well. You get to know the security very well. So you get to know the people in the hospital. During that time, I was not thinking about that at all. A former board member, somebody who's taken my children to Ronald McDonald Camp, somebody who knows the Ronald McDonald House, Northern California, very well. I didn't think about it,
Mm-hmm.
which I'm a little bit ashamed because I had to text Catherine and learn just let you know, my son and daughter applied for to stay there. So I didn't find out. I found out through my son. So he told me, hey, we applied for that. And I was like, oh, my goodness. I didn't even think about that because we're spending hours and days there. We wouldn't see them at all. We spent a lot of time there.
Mm-hmm.
So that's how we found out, as my son applied. And I was just thinking, what it can happen to anybody. It could be somebody on the board again where they have a emergency, a tragedy or something within their family, and they're just reacting, and they're trying to contain the emotions to have better judgment, better conversations. So I was actually my son and my daughter-in-law that applied.
And tell us about their experience.
Well, their experience, looking from my eyes, their first child. It was supposed to be a time of bringing a child home. This did not occur for 287 days. And they didn't know. They went through different stages. The first stage is shock. There was a lot of shock in our family. There was a lot of praying. There was desperation. You know, when you have a doctor or a surgeon tell you, we're not sure. I learned through this experience not to deal with percentages, and because obviously Eliana beat those percentages. So there was a lot of hardship on him, not only financially, because my son is at Sac State and college. He was trying to finish up his second semester of the last, I think, something like that. I can't keep track. And Taylor couldn't work. She had to be at the hospital for her daughter, spending the night and the hours there. And I really don't know what they felt. I don't know if I could handle it. It affects you deeply to the core, to the root.
And this provides that opportunity to take some of that burden off. It's one less thing you have to worry about because everybody can participate.
Right.
Everybody can stay at the home and stay close, knowing where the hospital is relationship to I'm assuming it's downtown Sutter.
Yes, it's actually really close. It's a few blocks away.
Right.
And it was a relief because they got him in as soon as they could. And to be 5 minutes, 10 minutes away, have that call, you need to come in, they're there. And it is a lifeline. The Ronald McDonald House there is a lifeline to families who are going by minutes, not hours or days, by minutes. And to have that functionality to stay at the house versus our home in Lincoln, could be a 40-minute drive, could be longer. They're instant access. And that is the greatest gift, Stacey, you and the charity have given to my family. And so during that time, you learn a lot. You know, I'm not a medical person. My wife is. But I'm highly impressed with Taylor and Aaron because they're very young, yet they are so mature in how they handled this. They asked questions. They sought help. They would reach out to us. They would reach out to other family members. And then, of course, like Stacey was saying, they would just go there to take a shower sometimes and then come back. So from their standpoint, it was a lifeline, a critical lifeline for them.
And to your point earlier, Stacey, where you were saying this is for anybody.
Absolutely,
as the need presents itself, but to think of a couple of students, assuming your daughter-in-law is a student as well, if not still, they're young. They don't have the means to hole up in a hotel or burden the expense. They can't sleep in the hospital overnight. They have to have a facility. And to your point, heading out to Lincoln, Jerry, that's an hour of angst that you'd be away from your child, not knowing what's going on.
That's right.
So here's a perfect example of an unbeknownst opportunity that presented itself. The only word appropriate is coincidence, but there are no coincidences. These things happen for a reason.
That's right.
And you had that familiarity, and you actually got to see in your own family the use of your efforts as a board member to come to fruition.
It's very humbling.
Yeah.
Very humbling. The definition of humbling doesn't really reach the depths of words that you can express. Is very humbling.
And the willingness to accept it too. I think that's important because there are people who could use the facility that maybe feel really awkward or uncomfortable about it and don't. It's there for
Right.
that purpose. That's why it's there. And if the opportunity's there, you're going to be serviced, and it's the right thing. And if you need to wait a day or two, you have to wait a day or two. It
Exactly. Yeah.
just is what it is. But thank you for sharing that. Now I have to ask,
Sure.
how long ago was that?
Oh man. So that's a. I think it was last. Let's see. It was last year.
So not that long. So
Yeah, it was last
Eliana's
year.
like 2.
I had to rewind it. Yeah.
She's 2 years old now.
No, she just turned 1 in June.
Okay.
1 in June.
There we go.
So yes, it started last year.
Well, I'm thrilled. You're a grandfather. You've
Thank you very
got
much.
Eliana with a story to tell.
A huge story and a miracle.
We'll see what she grows up to be. If she's a cheeseburger, fries, and chocolate shake, or
I'm sure she'll be
Yeah.
at the house volunteering.
which
with-
Happy
with
Meal she
Grandpa.
prefers too, right?
Yeah.
Right? Stacey, what you do is stressful. And I know when we were talking, it's hard not to take it home.
Yeah.
I mean, these are kids. I mean, you're in the space where kids thrive. And so you see the healthy siblings and you see the child that's needing care. How do you not take it home? What do you do for fun? How do you relax?
Well, sometimes you do take it home, right? And so, so things that I do with my husband, we have a boat. And that takes
It's a
a
nice
lot of time. And then we have a fifth wheel, so we camp a lot too. So we're outdoors a lot. And then my husband has this very interesting hobby of collecting tequila. So I tag along with that hobby, and it's a lot of fun. So we keep pretty busy. And then we have grandkids and kids. So never a dull moment.
Good.
Yeah.
Well, and outdoor nature, what a great way to escape from the pressures of human-centric conditions.
Yeah, exactly.
You know, you just don't have to deal with any of that. What's the best way to learn more about the organization?
So I would say go to our website, which is rmhcnc.org. And there we constantly update our events that are coming up, how you can volunteer, how you can donate, when the next work party is, where our needs are the greatest. And it's updated on a regular basis, so I encourage folks to go to our website.
RMHCNC,
NC.
so Ronald McDonald House
Charities,
Northern
California. Yeah.
Okay, .org.
Yeah.
Everyone, even if you don't have children, and I mean everyone, knows McDonald's.
Yeah.
We've all grown up with it. It started back in the 50s?
Yeah.
You know, with milkshakes and stuff. If anybody's seen or watched the story, it's an incredible story. I'm a fry freak.
Meh.
They are still one of my favorites. Extra salt,
I
please.
agree.
Always. 2 packets.
Uh-huh.
And not everyone sees the community resource that your franchisees are. I don't think they get the credit for what they do because not only do they give a percentage to the house from their sales, but they are big community advocates. They contribute a lot in the community with their stores, whatever that particular area is that they serve. So this is above and beyond for them.
Absolutely.
And I know they really value it because of the service that it provides. But you're making it possible for children and families to get the need and care that they may not otherwise be able to do in a timing and a situation where it may be necessary. And in some cases, it could be catastrophic to a family in terms of the expense that they would have to invest to do what they need to do just to be by their child. And nobody wants to be separated from their child when their child is ill or needs medical care. So what a treasure it is to have somebody like you, so passionate, so committed. Almost 30 years. Think about that.
Yeah.
That's a long time.
I know. It's
Isn't
scary.
that scary? But to just stay so focused on the mission for the duration, the equity that you bring to the experiential equity that you bring to the organization is really significant, and the ability to share that with the community. As I know, you probably go out to the Rotaries and the civic and service organizations
Right.
and Kiwanis, et cetera, et cetera. So thank you for what you do with all that. For the people that are in, you mentioned it early on, Jerry, desperate.
Yes.
It becomes a desperate situation sometimes, to where when you don't see there's hope, it really gets bleak. And it's just that little glimmer that all of a sudden, oh wait, we have a place to stay. Okay, we'll worry about, now we don't have to worry about that. We'll worry about everything else that we have to really stay focused on for child and family and siblings, if the case may be. So thank you for that, Jerry. Thank you so much for sharing the story. I really appreciate what you guys do. And if everybody, as you listen, you get an opportunity to go to the Ronald McDonald House, it really is an experience to see not only the walls of support that you have in the lobby when you go in and you recognize a lot of names in our community, but to see what's happening on the campus and how comfortable and stress-free it feels when you're there. And I have to do this because I'm trying. Ba-da-ba-ba-ba.
Well, that's right.
Thank you, guys. I appreciate it.
Thank you.
very
We
much,
appreciate
Jeff.
it.
Thank you for listening to the Nonprofit Podcast Network. I hope you enjoyed the episode. If what you heard moved you, please reach out to that organization and do what you can to help. If you like and appreciate what we're doing to support local nonprofits, please give us a positive review, subscribe, and share. If you're a nonprofit with an interest in participating in an episode, you can reach me at jeff@hearmenowstudio.com. Once again, we're grateful for the businesses who have made this program possible. CapTrust, fiduciary advice for endowments and foundations. You can find them in Sacramento, Roseville, and Folsom. captrust.com. And Western Health Advantage, a full-service healthcare plan for individuals, employer groups, and families. westernhealth.com.